So here's an example of a sickling disease. So this is a hemoglobinopathy for sickle cell anemia. Hemoglobinopathies are mutations in the hemoglobin genes as opposed to deletions as seen in thalassemias. So this hemoglobinopathy is a production of abnormal hemoglobin. In sickle cell anemia, this is also called hemoglobin S disease or hemoglobin SS and is typically characterized by a severe anemia with a hemoglobin between 5 to 9 grams per deciliter. The cells are usually normocytic and normochromic and show variable degrees of anisopoikilocytosis and polychromasia. So as we find our zone of morphology and go a little bit higher power, we immediately notice sickle-shaped red cells. Here's a few good examples, even in this one field, of sickle-shaped red cells. In comparison to elliptocytes, sickle-shaped red cells have pointed ends at both sides. These can sometimes be confused with teardrop-shaped red cells. However, a sickle cell should show pointed ends at both sides of a red cell. In adult patients with sickle cell disease will show signs in the peripheral blood of hyposplenism, or they may even have an absent or scarred down spleen. Signs of hyposplenism in the peripheral blood would include things like Howell jolly bodies and increased anisopoikilocytosis. As we scan around, I want you to see all of the different sickle cell morphologies. So as you could imagine, there are occasions where you could misinterpret these cells as elliptocytes. However, take this example as a prototype for what sickle cell or sickling disease looks like on peripheral smears. Hemoglobin S can be combined with beta thalassemia and hemoglobin C to also produce sickling disease. Therefore, the diagnosis of sickle cell disease must be made on hemoglobin electrophoresis, which in true hemoglobin SS disease will show 90 to 100% hemoglobin S and 0 to 10% hemoglobin F. Complications of sickle cell disease include periodic sickle cell crises, which may be vaso-occlusive, aplastic, hemolytic, and or sickle cell type. These crises are characterized by a sudden and significant drop in the hemoglobin, and the peripheral blood smear findings will vary with the type of crisis involved. For example, in aplastic crisis, there will be significant drop in the absolute reticulocyte count along with a drop in the hemoglobin, whereas in hemolytic crisis, there will be increased polychromasia, which can be seen on the morphology as increased absolute reticulocyte count, and a systemic sickle cell crisis is characterized by numerous sickle cells in the blood smear.